Flaring over a mental health bill at the state capitol. The bill's sponsors said it was intended to have mental health care be covered by insurance.
But today, demonstrators gathered, concerned that it could do more than that. Capitol reporter Haley Mason just got out of that hearing. Haley?
Tracy and Sean, this Mental Health Parity Act was actually the top priority of the Georgia House Speaker. Opponents said it would help people with mental health challenges get insurance coverage and also have them have better interactions if police are called to the scene. But today we saw avid protesters speaking out against it, concerned that it would mean the government could take over health care or that even parents would lose their rights. Lining the halls with posters and signs, passionate protesters gathered outside of a Senate subcommittee meeting, trying to speak about the new Mental Health Parity Act. The mental health bill would require insurance companies in Georgia to cover mental health care just like they do physical health. And in crisis calls, it would also require mental health providers to respond to a scene as a co-responder as police are called. Today's hearing focused on how police would respond to mental health crisis events and at what point they should transport a patient or not.
This is a positive step for law enforcement. Incarcerating the mentally ill who have committed minor penal offenses, criminal offenses, is not the answer, and it's costing us money.
Children's Healthcare of Atlanta fully supports the bill, citing that nearly 70 children have repeatedly gone to the ER in a mental health crisis 4 more times in the last year.
The emergency room visits ranged from a total number of 4 all the way up to one child who had 66 emergency room visits. When kids in crisis are repeatedly presenting to the emergency department, it's clear that this system, whether it's because of lack of access or because lack of coordination, is not meeting their needs.
Opponents, though, argue it doesn't give parents or the patients enough discretion.
Doesn't advocate for parents' consent. And I think that is a major problem with this bill. We need to have the parents' consent.
Others speaking out about possibly having transgender care covered under the bill.
Presumably, this would include gender affirmation surgery, including hormones and mutilation of body parts. This is Obamacare versus Little Sisters of the Poor all over again.
The measure that saw overwhelming bipartisan support in the House as the Speaker championed the effort as his top priority is now facing its second hurdle this week in the Senate hearings. And the sponsors of the bill say that some of those concerns about the government takeover of health care needs and patient autonomy being lost, they're saying that just simply does not happen under their bill. This was a subcommittee hearing, and it will be going for a vote once it gets to the full Senate Health and Health Care Committee. Reporting inside the Capitol, Haley Mason, CBS 46 News.